Approved use for UNITHROID. UNITHROID levothyroxine sodium tablets is an oral prescription medicine used to replace a hormone usually made by the thyroid gland in adults and children with hypothyroidism, along with surgery and radioiodine therapy to manage a certain type of thyroid cancer. UNITHROID should not be used to treat non-cancerous enlargement of the thyroid in patients with normal iodine levels or temporary hypothyroidism due to inflammation of the thyroid, thyroiditis. Important safety information. Do not use UNITHROID for the treatment of obesity or weight loss. Larger doses may result in serious or even life-threatening events.
I've heard about UNITHROID actually from one of my patients about 12 years ago. When I saw her for the appointment for the first time, she said that she was taking UNITHROID. I'm Dr. Alla Khalfin. I'm an endocrinologist. I live in Long Island. I've been in private practice for the last 12 years. I have 2 kids and a husband. My kids are 17 and 10 years old. We really love hiking and biking, and we do like to play board games together. So I'm not only an endocrinologist, I have Hashimoto's, hypothyroidism. When I was a fellow, I noticed that there was an issue. I had my son, and then I was trying to lose weight, and I was having trouble losing those 10, 15 pounds. And I asked my attending, because I was also feeling a little jittery and some palpitations. To treat my hypothyroidism, I started with the generic levothyroxine. And in the beginning, it was working okay, but then I started having a headache and my levels were going a little up and down. And so I switched to UNITHROID. And since then, my TSH is always between 1 and 2. I've been actually on it for the last 10 years, and it kept my levels stable. As with most medicines, you have to weigh the benefits versus the risks. I always caution my patients about potential side effects when starting a new medication. Side effects can happen, such as rapid or irregular heartbeat, chest pain, or shortness of breath. Anyone taking UNITHROID should talk to the doctor if they experience these or any other side effects. Since I've had the condition myself, I know that it could be treated, and I always tell my patients that we can go through it together. It is very important to take UNITHROID as it's prescribed. I take UNITHROID in the morning. It's part of my routine. When I wake up first thing, I take UNITHROID, and then I brush my teeth, I take a shower, I get dressed, and then by the time I'm ready for my breakfast, it's been already half an hour. I take UNITHROID because it's an affordable branded levothyroxine that I can always count on for hypothyroidism. UNITHROID has no history of recalls, no history of reformulation, no gap in availability, so patients do not need to be switched from one brand to another. UNITHROID is a branded medication that's being manufactured here in New York for more than 20 years. Generic levothyroxine could be manufactured in all different manufacturers, which could lead in inconsistency of the treatment and inconsistency in the TSH levels. Even the small changes in formulations can affect how the medication is absorbed in the body. So it's always important to tell your patients, as I always do, to check their bottle, make sure that it does say UNITHROID, that they check their pill and it says JSP on it, and also for the doctors to always write dispense as written on their prescription. Every situation and patient is different. When I prescribe UNITHROID, I know that they're getting an affordable, consistent, and quality product.
More than 90% of commercially insured patients pay as little as $3 for a 30-day prescription of UNITHROID. Approved use for UNITHROID. UNITHROID levothyroxine sodium tablets is an oral prescription medicine used to replace a hormone usually made by the thyroid gland in adults and children with hypothyroidism, along with surgery and radioiodine therapy to manage a certain type of thyroid cancer. UNITHROID should not be used to treat non-cancerous enlargement of the thyroid in patients with normal iodine levels or temporary hypothyroidism due to inflammation of the thyroid, thyroiditis. Important safety information. Do not use UNITHROID alone or in combination with other drugs for the treatment of obesity or weight loss. If your thyroid levels are normal, doses of UNITHROID used daily for hormone replacement are not helpful for weight loss. Larger doses may result in serious or even life-threatening events, especially when used in combination with certain other drugs used to reduce appetite. Do not take UNITHROID if you have a problem with your adrenal gland that has not been corrected. Starting thyroid hormone therapy before initiating treatment for adrenal insufficiency may cause a life-threatening condition. Do not take UNITHROID as the first therapy or additional therapy in a weight control program. Too much levothyroxine may affect your heart, especially if you are elderly or have cardiovascular disease. When starting UNITHROID, contact your healthcare provider immediately if you have any signs of increased heart rate, chest pain, or an irregular heartbeat. Too much levothyroxine has been associated with increased bone loss, especially in women after menopause. Take UNITHROID exactly as prescribed. Take UNITHROID as a single dose, preferably on an empty stomach, 1/2 to 1 hour before breakfast with a full glass of water to avoid choking or gagging. Products such as iron and calcium supplements and antacids can decrease the absorption of levothyroxine, so UNITHROID should be taken 4 hours before or after taking these products. It may take several weeks before you notice an improvement in symptoms. Once your healthcare provider has found your specific dose of UNITHROID, it is important to have periodic lab tests and clinical evaluations to assess your response. Treatment with thyroid hormone replacement will likely be lifelong. Before taking UNITHROID, tell your healthcare provider if you have diabetes. UNITHROID may worsen control of blood sugar levels. After starting, stopping, or changing UNITHROID, closely monitor your blood sugar levels and contact your healthcare provider if there are any abnormal changes. Are taking oral blood thinners. UNITHROID may increase your response to oral blood thinners. Are pregnant, plan to become pregnant, or are breastfeeding. Your dose of UNITHROID may need to be adjusted if you become pregnant. Have any other medical conditions, particularly heart disease, adrenal or pituitary gland problems, or depression. Talk to your healthcare provider about all other medications you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Do not change or stop any of your medicines or start any new medicines before you talk to your healthcare provider. Your diet. Certain foods such as soybean flour, cottonseed meal, walnuts, dietary fiber, and grapefruit juice may cause your body to absorb less levothyroxine and may reduce its effect. Taking UNITHROID before any surgery. Hair loss. Partial hair loss may occur infrequently during the first few months of UNITHROID therapy, which is usually temporary. Tell your healthcare provider if you develop any of the following symptoms: rapid or irregular heartbeat, chest pain, shortness of breath, muscle spasm, headache, nervousness, irritability, sleeplessness, tremors, muscle weakness, increased appetite, weight loss, diarrhea, heat intolerance, changes in menstrual periods, skin rash, or any other unusual medical event. These are not all the possible side effects of UNITHROID. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about your health or medicines, including side effects. To report suspected adverse reactions, contact Amneal Specialty, a division of Amneal Pharmaceuticals LLC, at 1-877-835-5472 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please read the full prescribing information on unithroid.com and/or talk to your healthcare provider.